Welcome, everyone. We've been getting a lot of questions about recalls. And one of the fun things about working in medical cannabis for 22 years is that I get to talk to a lot of experts about what's going on. And so we just wanted to bring some of these conversations that we've been having about recalls to our community and hopefully dispel some myths, but also help people sort of see what's going on with recall. So I'm going to jump in and I'm going to give just a quick overview. What's exciting about today's webinar is I have a bunch of experts. So I'm going to just do intros into the information and let them give you the real information. So I think if you probably noticed the way that we phrase this is what this means for the health of patients and the cannabis program. And you might find it odd that when I see this, right, which is like the headlines that we've been seeing over the last few weeks of recalls in all these various states, this actually makes me feel good. It makes me feel like, okay, these systems are working, right? And then I look at the list of states that don't have recalls and I get a little nervous. So yes, recalls, it doesn't mean it's a great thing, and it's definitely not great necessarily for the company if they're not prepared for the recall. But for consumers and patients, it means that that these products are getting taken off the market. And so we're gonna just sort of look at that. And so I didn't tell you who's here with me. So we have Dr. Lee Vinegar, who is really helped me understand the severity of the medical conditions caused by contaminants. Sort of my go-to when I'm sort of reading these labels and making sure I have it right. We have Kristin Nevedal, who has been a mentor of mine for a long time and is actually going to be speaking with us and telling us about what's going on in California within the DCC and give us some insights of the, instead of us just talking about recalls as a concept, she's going to walk us through what it looks like. So thank you, Kristin. And then, of course, we have Antonio Frazier, another one of my mentors for everything labs, everything product safety. So thank you guys so much. I really appreciate you taking this time and sharing your knowledge with our members. So thank you.
My pleasure.
Okay, so here's what we're going to go over in a quick hour, and we're going to leave time for Q&A. So during the webinar, if you have questions, put them in the Q&A. There may be some pause points within the webinar, but we'll definitely do Q&A at the end. So feel free to put those in there. And Amy, who you can't see, thank you, Amy, for putting this together and coordinating us. So we're going to be looking at what is a recall, why do we need them, what are some of the key elements, why contaminated products get past labs. I think a lot of people are like, if we have all of these regulations, why do we need recalls? Some of the impacts of recalls, recalls in action, that's Kristin's portion. I'm going to talk a little bit about the recall programs across the US, and then we're going to talk about sort of what we learned from these recalls. Sound good? Woohoo! That's the one thing it's hard about webinars is I'm used to like some woo-woo just coming back when I talk. So, all right, let's get into it. So, what is a recall? So, a recall it's a process to remove, replace, or exchange a product that may pose a risk to consumers. And I'm sure you've heard of all sorts of recalls on technology, recalls on chicken, recalls on lettuce, right? And these are processes that include companies and that include governments. And there's different types of recalls. There's voluntary ones, there's mandatory, and but both require participation of both companies and governments. And then there's different types in cannabis. We see is either inaccuracies, like the label is misrepresenting what is in the package, and the other is contamination. And so, oh, I didn't replay. Oh, yeah, I did. Okay, so this may look a little crazy, but this is basically the sort of how these systems work, right? It starts with the state legislature. They hand these amazing ideas with a little bitty tiny budget over to a regulatory agency. And as you can see, every single stakeholder is a part of recalls. That means consumers, you're a major part of that, right? If you see, if you have a contaminated product, hopefully you don't want to keep that to yourself. You want to let other people know. But it includes the entire supply chain, people who work within, the staff, the managers, the owners. So really everyone is involved in these processes, and these track and trace programs that everyone has complained about or scratched their head about. This is what they were for. So really recalls, we're kind of taking those out to for a test drive. And so today we're going to deep dive into some, more what are some of these elements that are important. Again, I'm just giving you the overview. The super smart people are going to weigh in on these pieces, but why we track and trace, what the communication, like once you know to recall, how you tell people, and then how do we know if the recall is effective? We're going to talk about what triggers the recall. It can come from inspection. It can be voluntary. Someone in the company can be like, that's not right. It can come from an inspection of their site or of a lab. It can come from whistleblowers. And, what we really hate to see is it sometimes comes from adverse events, right? That people get sick. And so any of those can start this process. But I want to back up just a little bit to give just give you some context of why there's so much evolution in our cannabis programs. And that is because this whole experiment at the state level happened because patients could not get medical cannabis to move forward at the federal level. And when we went to doctors, cannabis being outside of an FDA approved drug, we were really talking apples and oranges, right? Like these institutions weren't hearing us. We didn't understand them. And so we went to the place where most people were being arrested, where there were most arrests at the state level, to create these programs. And so the beginning of these programs were criminal exemptions, right? When I started Americans for Safe Access in 2002, there were 8 states that had medical cannabis laws, but they were criminal exemptions. They meant if you got arrested, you could show a judge a letter from your doctor, and they would drop the charges, but you wouldn't get your medicine back, right? You could still lose your driver's license. So nothing else except for that one. The charges being dropped for that case were there. And so I realized like we need to create a safe access. So we started with these collectives, like these amazing people that members would bring in their excess. But when we looked at doing a statewide program, even though some of the legislature, our champions in the legislature were, wanting to move this forward, they're like, look, we can't do this without regulations. And I think part of that was because our legislation had one line in it for regulations, which was Department of Health will figure out regulations. And so that's when we partnered with the American Herbal Products Association, the American Herbal Pharmacopoeia, and actually created the first cannabis product safety protocols. And these are the basis of all the product safety standards. Standards are not static, they're always evolving, but these did not really put into place until about 2012 is really when we started rolling these out. And so once we were able to do that, then the state legislatures, they went to the regulators, they said, yeah, we can regulate this. We know how to do this. And that's really what took us from criminal exemption programs to compassionate use, right? So even though it feels like, and for some of us more than others, we've been doing this forever, that we're still on, a learning curve. And cannabis it's not just another agricultural product, right? It's not just we can't treat it exactly like we would lettuce, right? We learn a lot from these. We learn a lot from herbal products and other components, but cannabis is a bioaccumulator, meaning it will pull any heavy metal or pesticide out of the soil, and it goes into the flower. It has high water content, so it means that its propensity to mold mildew. And so all of these issues are really unique to cannabis. And, there's also not, usually not the same person is necessarily handling the same part of the supply chain. So in cultivation, you have these issues, right? Manufacturing is where we start seeing, things that get left into the product during the process. And then in storage, which also means once you take it from the store, actually, or if you have a vape pen that you leave around for too long, you get heavy metals in that. So, we have to look at sort of this whole supply chain, knowing that there's all of these issues, and cannabis, these things are not just it's not a small thing, right? Like having a residual solvent in your vape can cause real long-term health effects, and short-term as well, like headaches and fever. But I think one of the scariest things about some of these contaminants, one is that you don't have an immediate symptom. And so you can't just say like, oh, wow, I think I feel myself getting kidney damage, right? It's something that you keep taking it, it's going to make that issue worse. And I'm not trying to scare people. I just want people to be aware, because if in these regulated markets, this is why we have these programs, is to make sure that these products don't get into your medicine. And guess what happens in a recall? They're taking it off the shelf. So nice. But for patients, it's not just, something that they could tolerate a little of. There are some of the microbials that are found in cannabis, and let me be clear, these are found everywhere, right? Microbials are every single place. They just accumulate in cannabis. And if you are an organ transplant recipient, if there's aspergillus on your cannabis, it can actually cause you to reject the organ, because it counteracts with the medication to keep the organ. If you are taking antacids or antibiotics, or if you have IBS, a little bit of salmonella on cannabis, which some people could tolerate, can make you really sick. And then there are also a lot of prescription drugs that make it harder for your kidneys and liver to remove pesticides and heavy metals. So these are, this is why we need to know what's in there. And so beyond, just buying something wherever you see it, I think you have to really appreciate what regulations mean and what regulators are doing. And so when you hear about a recall, you're like, thanks, I'm not going to get kidney damage. But also, I think this isn't something that people talk about enough, but incorrect labeling is also really dangerous. It's uncomfortable. It can be scary, excuse me. But it also can, if you are supposed to go to work that day, or if you're supposed to take care of your children, and you have a candy bar that's 100 milligrams of THC, and it's supposed to be 10 milligrams per serving, and you somehow get 90, it could really mess up your day. And a lot of people can't miss a day of work, right? So we're always really excited to see when companies voluntarily take something off the market, or if a recall is called because of inaccuracy in the label. And now I'm going to hand it over to Antonio. See how I like to leave that note for you. So Antonio is going to tell us a little bit more. So that was really just I went a little over 5 minutes, but just really a cursory over sort of when you see the big picture, and now we're going to get into it. So take it away, Antonio.
All right, everybody. Yeah, so Steph did a great job introducing kind of how setting this up. And what I'm here today to speak on is just, how does this happen? Everyone knows that there's testing labs, rigorous requirements, very expensive, causes delays, labs are wrong. There's all this fuss right now about testing labs. So we're going to discuss a little bit about how this happens. How do products get into the marketplace legally without with having these contaminants and draw these recalls? So there's 4 categories we can talk about. We're going to dive into each of them. First is that the lab may not test the exact same sample that is on the shelf. Cannabis is a very heterogeneous plant, and there's also could be some intent for that to happen. We'll talk about that later. 2, some labs are just unfortunately conducting bad practices to pass products that should not pass, and we'll talk more on that. 3rd, lab error causes labs to misreport a result. And then finally, the contaminant may not be on the regulated list. So sometimes the lab isn't even looking for the things that are end up being found by some of our agencies and by whistleblowers out there. So we'll touch on each of those topics right now. And here we are. First of all, let's talk about chain of custody. When I say the same sample that the lab tested may not be the same one on the shelf, that's because all across the country, the state laws vary about how samples are collected. Ideally, the lab will pull a representative sample from the entire batch of product, and that entire batch of product is best to be in final form because in that way, there's no other processing done after the lab tested. So we have some here, some good visuals of the cannabis supply
We
chain.
can't see your presentation.
You cannot.
Can you guys see it? I can't see it. You can see
Kristin
it?
saying yes.
Okay, never mind. Keep going.
Yeah, I can see
Okay.
it.
Goodness. Okay. Well, I'm surprised the chat wasn't going crazy if that's the case. Yeah. So,
Oh, there it is. I see it. I see it. Sorry.
Yeah. Oh, good. So, with that being said, a producer could submit a different product to retail than what is submitted for testing, and hopefully, with the systems like track and trace that are being implemented across the country, are being utilized and are improving to help minimize this happening. There are some states that have no track and trace, and that really is some of the things that Steph was alluding to, is that there's some states programs that really are behind the ball, and the reason why you don't see recalls is because they don't have the ability to conduct a recall. Another thing that we also mentioned earlier is that lack of standardized storage protocols and requirements can lead to some flower batches yielding more mold and microbes due to poor storage, whether it be through heat, moisture, whatever the conditions may be. Without a good, true best practices for industry that is standardized, there is a high risk that a retailer or you, patient at home, could have improper storage conditions to lead to this. And I want to remind everybody that yes, some of these things are ill-intentful and not great to hear, but this system does not exist in hemp or with the intoxicating hemp products that you may buy in a gas station or a smoke shop. There's no ability for recall or any of this kind of oversight in that system. Even if a manufacturer claims to be using these practices, unless they're willing to share their data and their information with the retail, how do you know that they're actually able to do this? So, that's something else I want to remind everybody. Yes, this is the early nation system, but it's not available in these other places where people are trying to get cannabinoids, excuse me. The next thing I'll talk about is lab malpractice. Just to give people an idea, a 2020 study published that it takes about $1.3 million just for the resources required to outfit a lab. That's not licensing, certifications, paying people, rent, leases, construction, none of that. This is if you already have something ready to go and you just need to get the things outfitted to read products at the levels that the regulations require. So it's a very expensive endeavor. And what I want to point out is that because of that, some of these younger, inexperienced lab employees are pressured by ownership to produce these favorable results because you don't really have some of the most experienced and well-seasoned chemists in this industry yet because of the pay and because of the fact that it's new and people are concerned with it. So therefore, some of these young chemists are pressured into really performing bad habits to produce these favorable results. There's also people that are manipulating the quality control samples that are required by a lot of the states in order to pass those and therefore release results. And then they cannot replicate those results when they get audited. And that's where you see lab enforcement beginning to increase as regulators become more aware of these things and do their follow-up. So you'll see all across the country, there is a lot of enforcement going on labs due to this big focal point of safety. Now, I think the onus is probably a little bit too much on the labs right now, but that will evolve as regulators and the industry start working together to figure out the best practices. And on the graph here, you'll see that's just to show the varying levels of requirements for ISO 17025, which is a very basic lab accreditation requirement that California has, but you see across the country, it's not the same. Not all the programs require this if they have any requirements. The third thing we'll talk about here is lab error. Quite frankly, I mentioned the inexperience of lab chemists. This does drive to more lab errors than you would see in a more standardized and experienced industry. There's also the difference between a research and production lab. A lot of these young chemists come out of college for research labs. Their first job is a research lab, where you're in a production lab with demanding turnaround times. And the turnaround times in cannabis are quite frankly I don't know, I was trying to say respectfully unrealistic. I mean, the labs are putting these data out in 3 or 4 days, but it really is a 5 or 10-day test if you want to ensure that the data is going to be defensible and not have issues behind it. If you really want your lab to do a good job, you want them spending more than 3 days on the array of tests that are required. So that is something that also causes more lab error than you would normally see. And then finally, the ISO 17025 requirement, if it was enforced, there should be a continuous improvement process to where the labs will clean up these errors. So continued errors are unacceptable in schemes like ISO 17025. And that's what our regulators have laid out. But because we're still in catch-up mode, that is still not being enforced to the level that we'll see in the future. And the last thing we'll talk about regarding labs is that labs can only see what they're looking for. There is no magic instrument, box, machine, whatever you may want to call it, that you put a piece of cannabis in and it tells you every single pesticide that's in it at what levels. It doesn't work that way. It costs hundreds of thousands of dollars and weeks or upon months of time to be able to examine for all the pesticides that we are federally aware of and are on different types of ban list and from federal agencies. Now, because of disconnect between state and federal law, those things are not necessarily understood quite well, but that is where we're headed. And the other thing that I wanted to point out is that there's a large misconception that if a pesticide isn't on a regulated list like California's or Florida's or Michigan's, then it's approved for use. That is simply not true. That is not an authorization to use a pesticide to keep it under a certain level. There is a process in order that you must go through in order to register a pesticide and ensure that it's being used appropriately. And unfortunately, with cannabis being fairly banned, there are not many options out there. I'd be happy to link if there's any growers or people interested. Dr. Josh Sweeter from Infinite Cow put out a great dichotomy of are pesticides allowed or not in California cannabis. And one of the resources from that was this memo from the DPR that does lay out pretty well here. And I believe it's from 2021 or so. So there really shouldn't be much confusion around what people should and shouldn't do. And I'll drop a link to that here in a bit. But yeah, there are a few things that are allowed to be used, but not like what is currently happening, what we're finding on the shelves that are causing these recalls. And also some of the things that we're finding on the shelf from the regulatory agency are beyond that scope. And they will continue to do that to ensure that they're monitoring true pesticide usage and safety. So there's some confusion about that, why they're pulling things and talking about pesticides that aren't regulated. It doesn't matter. It does matter. I mean, a brand just saying that we passed the pesticides allowed by the DCC, that's pretty poor jargon and not and doesn't have much concern for consumer safety. Now, recall does have impacts. It has large financial impacts. Recalling products impacts brands' bottom line. This is why so many of them fear recalls and why so many people also fear failed tests. And they pursue these bad labs in order to get it through the system as opposed to dealing with that financial impact. Also, reputational harm. It's bad for a brand, but it's also bad for our marketplace. It's also bad to, bad for the marketplace when you're doing these things intentfully. It's a healthy sign of a regulated marketplace, but we do know there's instances where people are not really playing at the standard where they should be. There's clear regulations out there, and a lot of people, unfortunately, are still pushing it. So I'm not saying because there's a recall things are bad. I'm just saying when you see the repeat actions and lack of proactiveness from certain brands, it should certainly alarm you. Now, what makes a healthy recall program? Well, first and foremost, the state legislator must give a cannabis agency the authority to do this. That is first and foremost. If that's not allowed by the legislator, then they have no ability to make this happen. You also must have the tools to measure. So state reference labs, which again are very expensive, timely to put up. They take time to roll out and to be confident in their results. And they have to do sometimes things beyond what the regulations require because they have to defend their results in court. So they may be validating at every matrix that they may have a complaint about, whereas a cannabis lab could potentially get licensed by only having to validate in one matrix type. The other thing that you have to do in a recall program is determine that consumer risk. This is just, a summary of all the different things that we're seeing across the country that are being examined. But here's an example just strictly from heavy metals here that shows that depending on how you're taking it, there's a different risk associated with the consumption type, whether it be a tincture, smoking, or a topical, so something going through your skin, transdermal, excuse me. Yeah. So all those things make a difference, and a good, healthy program is evaluating those risks through doctors in order to determine where they should be set. Another big part of this process is communication. How do people know this is happening? Is there a centralized resource for patients to understand what recalls have happened, who could be impacted, when, what, where? All those things are important, and it's not standardized. California has a repository, but other agencies list them in bulletins, and you cannot find them in one place. You have to be able to search through a list of bulletins as opposed to a centralized recall resource. And then another thing that we're seeing from regulators is that, how do you measure the effectiveness of it? You know, how many units of products were sold across the whole life cycle, or after the recall was taking place? Are people adhering to these things, or do we need to follow up with retailers and further scrutinize them if they're not following the things that we have in place? You know, what were the harvest dates of the product recall? That may tell us how long things were in storage and could potentially have caused what happened to the product to be during that part of the process. And finally, you know, as the interim director of PFC, I have to just make note that the PFC program provides all these guidelines for things like this. If you're a retailer or a manufacturer and do not understand how to set up these processes, this is what programs like PFC does. At one time, it was ISO 17065 accredited because it had all the things required to truly have consumer safety first from a third-party source. And this goes beyond things like ISO 17025 and 9001 to very specific cannabis requirements to help eliminate these things. So please educate yourself, or at least find resources that have this stuff available. It's not impossible. This isn't anything that is obviously we're still studying this plant and we're still understanding how it impacts us in different ways, but there is enough knowledge out there to avoid some of the, let's call them, hiccups that the industry is currently experiencing with some of the operators and producers. And that's all I got for us today. And please ask any questions or drop anything in the chat there. If you have anything specifically related to testing, I'd be happy to, you know, jump in or follow up with you. Thank you.
Yep. We do have one question here about testing. I think it'll be a quick one before we hear from Dr. Vinegar. And one is just that, you know, for a lot of industries, 1725 is voluntary, but it's sort of mandatory for cannabis. They're saying that there's no other industries that have the, you know, that have this much oversight. And just wondering what your thoughts are on that.
Yeah, I mean, so yeah, IS 1705 is very general. It's not specific to cannabis. That's where PFC tries to fill that gap for labs that may be going through it. And I don't know if IS 1725 isn't required everywhere. The idea behind it is that, you know, someone must build a quality management system, document and proceduralize what they're going to do, and have traceable records to prove during an audit that they are doing what they say they are going to do. And as well as they have things like metrological traceability to a standard like NIST, which is very important. And that's where those quality control standards I mentioned must be traceable too. They must be certified reference materials. Otherwise, you can't guarantee that they were reading accurate, or that you understood that known that you're injecting onto your instrument. So yeah, I mean, the 1725 isn't end all be all, but it's definitely a great start, and it has different things in it that would help the program. For instance, uncertainty is a requirement for ISO 17025. So if everyone knows their uncertainty values, we should be able to report that along with potency. And that should eliminate some of this variance we're seeing, because people will understand potency is not an exact number. It's a range, because it's an analytical assessment. It's always going to be a range. There is no exact number. So if that was reported, maybe some of this chase for, I need my 28 to be a 31, wouldn't even be there, because people would understand it's all the same thing in the reality of it. Nor do we know as consumers that it doesn't really have that much of an impact on the quality of your experience. So different soapbox there, but that's my answer, and how I think it impacts the industry.
And I think also, I'll just add to that, is that, you know, you have to remember, again, the entire cannabis supply chain, we've had to fill in the gaps from all businesses in the United States, right? So as we were moving into this space, knowing that we needed testing labs, we couldn't use the lab infrastructure that exists, right? So there were a lot of really amazing people that stepped up and did that. And then there were a lot of just sort of really interesting, like machines in a van where it would show up and test your stuff without calibration. And so honestly, I think that this, that putting the standard in was just sort of just to push some people out, right? Like I think that is basically sort of where that came from, honestly. And I think that as we, as we move into a more legal space, right? What is also going to open up to the cannabis supply chain is not just banks, but it's also going to be the entire infrastructure, right? It's going to be labs. It's going to be, these right now, every single state, if they want a reference lab, are having to set that up. So,
No,
right.
precisely. And I'm reading the comments now, and like you said, it creates a threshold. It's not an end all be all, and it does not declare technical competence. Yes, you're like they're supposed to evaluate if you have competency to perform what you're saying, but it does not necessarily declare that a lab is doing something perfectly. It's more of a management system that you can that you have to adhere to with the validation to get started. So I definitely agree with some of the comments in there.
Yeah, thank you. All right, Dr. Vinegar, tell us about these contaminants.
Well, I mean, it obviously depends on what the contaminants is. The first issue is especially people using it for medical cannabis. I mean, these people have various medical conditions. They could be immune compromised. They could be on a whole host of medications that could interact not only with the cannabis, but with residual solvents that may be in there. So it really, being a medical cannabis patient, puts you at greater risk if there is contamination. And, there are a lot of issues now with cannabis. It's a little bit similar, not completely. It's sort of in the nutraceutical world, in the prescription drugs, not that there aren't recalls with prescription drugs, but they're very rigorously tested on the front end. And then there's now stage 4 FDA required testing to see when the drug is released into the general population. Is anything else happening? And the adverse events reported. And we're still very nascent, patchwork of different laws and regulations in every single state. That's why, possibly, I know people were on the webinar, changing to a separate scheduling can sort of help create at least something more cohesive nationally to help guide states and such. But it's sort of that patchwork of what's going on in each state and what's being tested and what's not being tested. So, obviously a bacterial contaminant that can hurt immune compromised people, that could hurt anybody. And how you are administering your medical cannabis, or, even adult use users, is very different. When we ingest things orally, we do have some protection of our immune system. Our stomach acid can deal with small bacterial loads and things like that, versus when you're inhaling something that goes directly into your lungs. I mean, Steph mentioned aspergillosis, which is a very common mold that can be on anything. And if you inhale that and you're a cancer patient who's somewhat immune compromised, you can get a serious lung infection that's very hard to treat. I know that Antonio and also Steph mentioned all along the way, all these people touching the product before it gets to you are just different sources of contamination. As a matter of fact, what's interesting, if you look a parallel into the food industry, right? Lettuce, if there was a contamination of lettuce and everybody just bought their head of lettuce, it wouldn't be so widespread. But now there's processing plants, all the lettuce is mixed together. It's all chopped up. You can buy your bag of ready-made lettuce. And the FDA has been saying, and the USDA, that's why you're seeing widespread issues with perhaps E. coli and everything. It's the processing and the extra handling that also puts you at risk. And again, labeling issues are always an issue. So there's the issue of residual solvents, which depending on how it's processed can be very serious contaminants that may be carcinogenic. Okay, so that is something you're not going to see right away, right? Things that cause cancer take a while to happen. So that's an issue. Then molds are an issue. Are you ingesting it? Are you inhaling it? What's your medical status? That all affects what's happening. Heavy metals, as we said, in the old days of hemp crops and such back at the time of George Washington when he was planting hemp, it's a great remediator for the soil. It can take up all the contaminants in the soil, and people used to alternate hemp crops with their food crops just to clean up the soil. So that's an issue too. Antonio's right, the hemp industry, and don't get me started on the intoxicating hemp, which I feel as a physician is extremely dangerous because there's no oversight in that, and the chemicals they're using, perhaps hydrocarbons or whatever, to change the structure of hemp, closing that circle from CBD to create something that's a little bit like THC. Or a THC compound, that is potentially dangerous, and nobody's testing that too. So there's a whole host of issues that people have to consider. And that's why for medical cannabis specifically, I always tell patients or patients that come to me in my practice are usually referred from physicians. And, a cancer patient getting referred to me is something that I make sure very carefully. We go over the products, we look at the COAs, we make sure. But I do know if there's bad actors in any field, including whether they're processors, growers, or whatever. I had a friend that was in the testing business very early on. She was a chemist and started a business very early on, I know, in Maryland with the testing. And there were a few bad actors. They would send out their samples to 3 different labs and then cherry pick the ones that are the best. So it's an issue that's important. You definitely need to talk with your physician about it if you're taking it. Now that there's adult use all over, a lot of people aren't going to physicians and they're self-medicating, but people have to understand, cannabis is not 100% safe, even if everything's okay, because there are drug interactions and there are things that you need to know about if you're a medical patient. So you need to talk to the physician. You need to ask for COAs. You need to look at those. But again, there needs to be these state regulators that Kristin will talk about, that'll make sure that the CAOs are accurate, the certificates of analysis, COAs, are accurate. So there's just a lot of issues along the way. I'm not a person, big pharma has their issues too. We know the food supply and the food chain has issues. So it's just important to be vigilant, not completely scared and terrified, but just to be vigilant and ask the right questions and follow up. So.
Yeah, thank you so much for that, Dr. Bittiger. I think, having a situation where people aren't talking to their doctor about it, but also people don't necessarily realize that a symptom is a contaminant, right? Like you would never associate something like I got hives once from an edible that I know probably was a residual solvent, but I was like, what is happening? I'd never gotten hives before in my life. So I think that, it's your doctors are actually protected now 100% under federal law because of the Research Act that was passed and signed by Biden in 2022. They explicitly gave doctors the rights to talk to their patients. So, if something doesn't feel right, you should tell them. Like, yeah, maybe they'll be a little judgmental, but But your health is important. So, all right, Kristin, let's hear about California.
All right. Well, thank you very much. I appreciate all of the, overview and the information received so far. So, some of the important components that our statutory and regulatory framework lays out related to recalls is the statute and the regulations really explain or provide authority for the department to recall both adulterated and misbranded cannabis and cannabis products. And I'll talk about that a little bit more in a moment here. Statutes and regulations also establish a framework for both voluntary and mandatory recalls in the state of California. And I think one of the most important components is that they also provide the department authority to freeze cannabis and cannabis products in place, which we call an embargo, if the department has probable cause to believe that cannabis or cannabis product is adulterated or misbranded. So as soon as the department has a reason to believe that that cannabis is adulterated or misbranded, we can stop it where it is in the supply chain, so it can't move throughout the supply chain, and it can get called off of the shelves at the retail store and held in the storage area. So we can stop that access almost immediately through that embargo authority. Furthermore, the regulatory framework here in California requires licensees to establish recall procedures and then submit those procedures to the department for review. So to Antonio's earlier point, there is an expectation in California that businesses have a plan to recall products should something become unsafe or get through to the consumer portion of the supply chain. We expect them to have the ability to recall those products and work with the department on any recall notice we issue. Also, statute assisted the state of California in developing state-run reference labs and also the use of reference labs outside of the DCC, so to speak. And those labs are subject to regulations and standards that are applied to licensed testing laboratories. They must be able to test for the contaminants listed in the California Code of Regulations at the thresholds identified in those regulations. And regulations do establish testing thresholds for microbials, 66 different pesticides, solvent residual, heavy metals, mycotoxins, and even foreign materials such as glass, sand, cinders, dirt, mold, you name it. But I want to repeat something that I think was really poignant that Antonio stated earlier. So notable about pesticide thresholds is that this is not a permissive list. So when you see the list of pesticides in any state regulations, it's not creating a permissive list. It's really not identifying allowable pesticide use. Instead, it's a product safety threshold list, right? It's a testing list for the final form product. Just because a pesticide doesn't appear on a threshold list doesn't mean that it's allowed for use in cannabis or the development of cannabis products. And to Antonio's point earlier, pesticides are regulated by the Department of Pesticide Regulation, and they do have resources available for farmers and cultivators of all crop types. So if you are a cannabis producer, farmer, cultivator, and you have questions about appropriate pesticide use, please do reach out to the Department of Pesticide Regulation. I think they can support you with some guidance. So in California, we issue recalls for two reasons, right? Misbranding and adulteration. And so when we think about adulteration at a high level, it means that the cannabis or the cannabis product may have some form of contamination or additive in it that's not necessarily allowed or appropriate. So examples of adulteration could include that the product was produced or packaged in an unsanitary condition that may have caused some form of adulteration. Perhaps the product is considered adulterated because it contains filth or decomposed substances. So there's a number of reasons why you might see something recalled for adulteration. And then if we look a little more at misbranding, misbranding really is when the product put on the market is not what it's purported to be, right? So in California, products can be recalled for misbranding because maybe they were cultivated, processed, manufactured, packed, or held at an unlicensed location, or that product consists of cannabis or cannabis product that was cultivated, processed, manufactured, or held in a location other than what is noted, right? So maybe it went through a different route in the licensing supply chain, and we can't understand exactly where it went and was held, but also labeling and mislabeling. So THC inflation would be an example of not only a misbranded product, but in California, we would also consider that an adulterated product. And perhaps the labeling or the packaging doesn't conform to rules or regulations, right? They forgot the California warning symbol, or had to put a sticker on it and it overlapped an ingredient label for some reason. So we have the authority to conduct those types of recalls. And then quick difference between voluntary and mandatory recalls. Products that are taken out of the market, they're all recalls. And what happens as far as that product being recalled from the market is the mechanisms are largely the same, whether it's voluntary or mandatory. And so voluntary specifically, licensees may conduct a voluntary recall unless the Department of Cannabis Control has determined that the cannabis or the cannabis product creates or poses an immediate and serious threat to human life or health. And other remedies would cause an unreasonable delay, right? It would delay the recall, in which case the department may use a mandatory recall order. But the department may also request or initiate a voluntary recall. So if there's a simple labeling issue that's not necessarily creating an immediate and serious threat to human health, we may opt to work with that business to issue a notice of voluntary recall versus a mandatory recall, which really is kind of a higher level of urgency because there's a reason to believe that that product being on the market may cause immediate or serious threat to health and human safety. So, and then I think it's important to understand that when a recall is put forward, there's really important mechanisms that take place or actions that take place, right? So anytime the department is ready to notify the public that a recall is happening, we're also notifying the legal business who's responsible for the product so that they are involved in the recall. They can trigger their internal recall protocols and start helping us move that product out of the supply chain, right? We freeze the product in place, right? So we issue the embargo, we might put a hold on that product in metric, we expect it to be removed from sales shelves and not to be sold or transferred within the supply chain. It literally needs to stay where it's at the time the recall starts. We do post recall information to our website. So there is a list on our website. If you go to cannabis.ca.gov, you'll find in the resources section a tab that will take you to the recall page where you can see every recall conducted by the department over the course of several years. And we send a consumer advisory out via email. So it goes to our entire listserv. And then we post a recall advisory to Facebook, Instagram, and X, formerly Twitter. And then we work with the licensees who have these products in place to ensure that they are properly handled, remediated if they can be, and disposed of if that's the proper course of action. So I know we're a little short on time. I'm going to cover this and pass it back over to you, Steph. I'm
Thank
getting
you.
the sense that you're ready to go
Yeah.
on to
No
questions.
worries, no worries. I know that both both Dr. Vinegar and Antonio have a hard stop, and I said I want to make sure I get some of the last slides in, but also that I ask a couple questions here. And we also and thanks for folks for putting these in the Q&A. But there's one for Antonio that I ask him, and then there's one that I think you'll like, Kristin. That's the cultivator in you. But this is really interesting comment, which is, there's a lot of fines and things out there around labs that are doing things wrong, right? Where we're constantly talking about the how to punish bad behavior. And the question is, are there any ideas to incentivize good behavior, right? Like, and I think this is something that we've seen for a long time. Like, how do you in such a crowded space, right? It's hard to strive for excellence when really just doing it right sometimes puts you at a commercial disadvantage.
Yeah, I was getting ready to type an answer to that, and I'll just say, I'm sure there are programs you could do that to reward good actors. I think that would involve the agencies getting involved with the choice of free market at that point, though. So, how much do you want the agency dictating who can test where if everyone is licensed and quote unquote approved? My clear gap that I see right now is that there's rules out there and labs just aren't meeting it. So until there's enough respect of the regulation where all the labs want to operate at the same level, I think it's hard to really propose this unless the agency starts telling people where they can test and where they can't. So and today wasn't really the focus of today. The focus of the day was just how does this happen? So and we know that some labs are letting this happen for financial incentive, and that's just really what we wanted to focus on. But I'm open and would love to hear any suggestions of something like that, right? But I know this only way I could think of it is that the DCC or someone would control, agency will control the sampling event, or two, like I've heard in the chat a few times, they just control where people can test and they send tests somewhere else, which are all things that would lower the risk for patients. But we know as entrepreneurs, a lot of people will not go for that. So it's really about what is the end goal. And if it's consumer safety, that is certainly a viable option in my mind.
Yeah, no, thank you for that. And thanks for that question. I think that, there is, this is something that we have definitely seen a long time is like, there are people who are willing, to sort of be a part of this experiment, but there are definitely people who take advantage of it. And I think what is a challenge for companies that are doing the right thing is, I talk to people who run labs all the time that have left because they are just unwilling to to compromise their ethics at this time, to serve, to kind of be on par with the the business practices. But I do think that there's, and again, we're kind of focusing on recalls for this webinar, and we'll definitely have more to talk about the supply chain. But I think that there's also we are over testing because we're not doing enough inspections on the and during the supply chain. So we're not doing enough visits, and I think that as these regulations become more standardized, I think that we're going to see people are going to get weeded out. There's definitely people that this market isn't for them. There's definitely people who definitely companies take it use regulations to push people out. I'm not saying that doesn't happen, but I think there will be a balance. And I think what's hard is the people who we're still sort of in a frontiers area. Like we haven't gotten to the settlers yet, right? Like we're still the businesses that are here are figuring this out. So I just wanted to really quickly show you guys some data. We're actually doing we'll be releasing a updated version of our our regulating patients' health and update some of those testing components. But we're also going to be doing one on recalls. And so, this is just a state by state over the years, the different recalls that have happened. I think if you're just looking at this, you're like, wow, what's going on with these states? Why out of all of the states that have medical cannabis programs are only these states doing recalls? And here's a quick data dump of the various recalls by state. And again, something I keep hearing from folks is like, is cannabis getting more unsafe? And the reality is actually no, where these programs are finally working. We're finally getting the protocols in place. And I think, the other item is once these are working, then we're going to see costs go down, right? If nobody can cheat, then the cheaters are going to have to leave. Once this is settled in. So again, I'm very appreciative of those who are working on getting out the kinks in these regulations. But here's just sort of an overview of the various recall programs that have happened. I thought this is another interesting data point, and this is all publicly available data. And I just want to really put a shout out to Jamie Toth, who put this together for us. She is an amazing researcher, and like so many advocates I know, underappreciated, definitely underpaid. Most of you may not know this, but ASA is almost entirely volunteer run these days. So, but this is sort of a breakdown. We see pesticides are, over time are the biggest reason for recalls, which if you look at the long-term effects as far as contaminants go, I'm glad to see those getting off the market. And so while I find all this data very interesting, I think what is frightening is this, which is the green states are states that have recall programs that actually tell consumers about it, that there's like a consumer facing side. The gray states don't have recall programs. And the pink ones have recall programs, but we're not really sure what happens. So there's not a lot of transparency so that consumers know. And so I think that we're definitely always advocating for better and improved protocols. And especially when we look at, ASA puts out a state of the states report looking at the product safety protocols along the supply chain. And I think one of the reasons that states are depending so much on labs is that they're not putting these protocols in place upstream. And so just wanted to give you that little quick one. And so, but there's also a lot we can learn, right, from recalls. We know that reference labs are working, right? They're sort of giving there's a constant to be able to see, who the bad actors are, how things are working, really set a standard. And I think that's been a challenge for everyone in the product safety, but also for patients. Like there's not one thing we know to be true, except for we know we can't trust one thing. But I think it also helps us see like what pesticides are actually showing up. So, adding new pesticide requirements in other states. I'm looking forward to having not have to have these geofences for science as well as for patients. And transparency, it's possible. I mean, that's the other thing that we're learning is we're seeing some of these programs. Michigan's doing a great job. Colorado, California, where there's actually a place where patients can find the information easily. And I think there's, we look at the pesticide component. I've worked with lots of cultivators, and I think there just needs to be more education on dealing with pest management. That you're not having to have a knee-jerk reaction to pesticides. And so, just to give you guys an idea of sort of what this means for patients is, we're literally teaching patients what the symptoms are of contamination because these markets are not so clear. And so educating a patient, we can't just say, go look for these cannabinoids, right? We have to sort of tell them like what they're going to be entering. And again, like I am pro medical cannabis, and I want people to have this information. But we also encourage people to get involved with the regulatory process, right? I think that if everybody spent like 1% of the time that they spent on social media, complaining about what's wrong, if they spent 1% of that actually talking to people who have the power to make that change, I think we'd see a lot of difference, right? I think that a lot of time policymakers aren't hearing from certain people. Yes, there are lobbyists. That is definitely a component of who has people's ears, but it's also more so that if they're not hearing from you, they don't know this is a problem, right? I think one of the most interesting things for me being a medical cannabis advocate is just how much I've had to learn and see everything that touches this medicine. So take a look at that guide. And of course, we are looking at federal legislation that would create an Office of Medical Cannabis and Cannabinoid Control that would actually help states with this information, right? This is what we're seeing in other countries. And there's a lot in here, and I know people like to grab one piece here and there, but I think that as we're talking about moving forward with medical cannabis, we're talking about the patients who don't have access as well as the ones who do. So within this legislation, home cultivation is encouraged and will be allowed. At the same time, be working on figuring out what a prescription would look like, meaning how can a doctor and a patient have a conversation about a product that's available, right? Like how can they be having that same conversation, and how can we integrate medical cannabis into our healthcare systems? So take a look at that and check out sorry, my voice does this. So just check out our website. We have a bunch of things going on. We're going to be in DC next week, the Validated Voices conference. And then again, I just want to thank Jamie so much. She's been an amazing advisor. All the charts you saw, this data, it's a lot of work pulling these and hunting down these recalls and putting them into data that we can understand and really guide our advocacy. So thank you. And this is the question I have for you, Kristin. It's a cultivator question. Oh, let me share. Is PFAS in Maine are being uncovered and vegetable gardens are being contaminated. Cannabis plants in the ground and soil accumulate PFAS also, question mark?
I mean, I think there's potential for that, right? I am not an expert in what items cannabis plants will pull out of the soil as far as contaminants. But, there are some options for post testing, right? The cultivator can conduct testing in California, and not final COA testing, but a cultivator can do what we would reference as R&D testing to see what, if anything, is being accumulated into the cannabis material itself. And soil testing can happen ahead of time to identify concerns before planting takes place, right? Yes.
I just want to say, actually, some people are using the fibrous hemp to pull the forever chemicals, the PFAS, which are the, perfluorosulfonic, there's PFAS, all those forever chemicals, and they're using hemp to remediate. So I would venture to then guess that if hemp can pull it out of the soil, cannabis, that's got the higher than the 0.
They're the same plants.
We'll pull it out of the soil. So
yes, absolutely. And I'd say feel free to reach out to I would definitely be happy to connect you with some laboratories in Maine that that are doing testing for patients that bring things in, but 100% they are pulling those out of the soil. I was working in the Czech Republic at a center of excellence for cannabis and cannabinoid studies, and we we actually planted, it was an experiment where we put hemp in this field, and then we were working with these universities. And so we did every single test for the last 50 years, right? So this is not, it's not an economical solution by any means, but it was an experiment. And we found chemicals in that field that had not been used since World War II that they pulled out. So, so yeah, I think that, especially in states, yeah, where you have home cultivation, you know, bringing that up, and yeah, I think there is reason for concern. So that is, we went over a little bit. I want to thank everybody for joining us today. Thank you for my guests. We are going to be starting in October having Lunch and Learn Wednesdays. So little 30-minute webinars. I'll be bringing folks together for a little bit of education with lunch. So bring your chips, and I'll see you guys in October.